is available on Health Pathways, as well as the referral sort of / consent form that Neil spoke about. So we'll just flick through to the next slide, please, Claire. So for those that don't know me, as Claire said at the beginning, I'm Bianca. I'm the Director of Primary Healthcare Improvement here at the Northwestern Melbourne PHN. I'm one of several, I guess, team members working on the introduction of COVID Monitor as part of the West Metro COVID positive pathways. I am going to give a little bit of an update onto what COVID Monitor is, and then hopefully the test system wants to play nicely, and I can give you a bit of a demonstration of the walkthrough of what COVID Monitor looks like. So what is COVID Monitor? It's a secure online portal that allows so practices, to view all of the patients enrolled in the model from your practice in one clear dashboard. It has a feature that we don't have currently in the Redcap system, which is self-reporting symptom monitoring for patients that we're hoping will reduce the burden on GPs needing to call patients every 2 days. It's a system that's been in use in the other, so the Southeast and the Northeast Metro COVID positive pathways. But as Dr. Allard mentioned, those pathways have utilised GPs a lot less than our program has. So whilst we're using something that's been sort of built for those models, we really need to make sure that it's going to work for the way that our program works, which is at the moment about sort of 70 to 80% of patients being managed by GPs. So we really want to make sure that we've got opportunities such as these and throughout the support we're providing to hear from users of the system to work out how we can make sure that COVID Monitor is going to work for GPs and practices in our region that are managing those such large volume of patients. So what COVID Monitor does have is the ability for practices to, as I said, view a list of COVID positive patients associated with your practice. And that includes both those that have been assigned to you to look after as part of low risk care, but also gives visibility of those in the medium and high risk. So at the moment with the Redcap system, we know that sort of GPs say, I know that the patient's husband or whoever, and another relative that they know of is in, say, Royal Melbourne, and they have no way of knowing that. This is going to be giving you the ability to be able to see all of that at one glance. You'll be able to see the patient details of any patient that's been associated with your practice, and that's the association is that through the assessment process, the patient nominates your practice as their regular practice, and they'll appear on your list. I'll go through a little bit more what you can see in terms of timelines and symptom history. You can use the system to set up scheduled follow-up if required, and by doing that, patients then appear on your follow-up list. I do want to say from the outset that totally acknowledging that this is a system that currently doesn't integrate with practice software, and appreciate the barriers that may bring, and that's certainly something that we're wanting to work with the vendor on, building that link between the practice software, but just want to be really clear that that currently doesn't exist in its current form. You can request discharge from the program, and you're able to enter symptoms on the patient record as part of COVID Monitor, and you can then record that as part of your consultation. So at the moment, for those of you on the line who have been managing COVID positive patients, you've been getting sent a survey to Redcap every 2 days. And if you complete those surveys, they sort of go back into the Redcap system, and you've got no way of seeing that, and then have to enter into your practice software. So this actually will download a PDF automatically of the clinical sort of the assessment that you can either upload directly into your clinical system, or you can cut and paste directly into your clinical notes. So hopefully reducing some of the double entry that we know currently exists. And you can also view patient reported symptoms, which again is something that we haven't had within Redcap. And that's obviously if a patient chooses to enter that into the system. So next slide, please, Claire. So the main differences between COVID Monitor and Redcap, if you've been reading our COVID e-blast, you may have seen this, but I guess the biggest difference is that patient-reported symptom monitoring. So in Redcap, that's not a functionality, but it will be able to be done in COVID Monitor. I'm certainly acknowledging there will be some patients that don't wish to do that or aren't able to, but symptom monitoring survey is sent daily to complete and reminders if patients don't do that. You'll be able to get access to the patient recorded symptoms and symptoms over time. So be able to see at a glance whether a patient is reporting that they're feeling better or that they're actually starting to feel worse. And that would be, again, give you that over time view that we don't have as part of Redcap. You can see which patients are allocated to your practice. So as we said, it does give visibility of all patients in the model, regardless of whether they're at the low, medium and high risk pathways that Nicole spoke about. It also gives you a view of those low risk patients that are currently allocated to your practice for management. And I suppose one of the advantages that we're hoping from this system is that means that we know that some practices are set up either the practice manager or practice nurse or perhaps even a lead GP to be that kind of COVID lead. And you're actually going to be able to see how many patients that you have at any one time, which is a bit harder it's a much more of a manual process at the moment with Redcap. And as Nicole said, we've had practices that have managed really large numbers of patients at once, and we're hoping this will help sort of distribute that workload and make that a bit more visible at a practice end. And any nominated staff member at the clinic can have access to the system to assist in managing the workload. So it's very much up to you as to who in the clinic you would like to be able to access that. Spoke about the ability to download a copy of the symptom monitoring outcome, setting an agreed schedule for follow-up. And so we're hoping this gives a little bit more flexibility, and we'll talk a little bit about this later on, around if a patient is actually adding in symptoms and they're pretty mild symptoms and going okay, you can actually be a bit more flexible than Redcap is allowing you at the minute, that sends you that update every sort of 2 days to follow up. You can then set an agreed schedule for the patient depending on what you know about their ability to be able to manage that symptom monitoring and reach out for help if they need. One of the other big differences that you will need to log in. So at the moment, Redcap just sends, as you know, an email or SMS with a link. In the COVID monitor situation, that's pretty much what the patient will get. But as a practice user, there is two-factor authentication that'll be required because it does provide access to patient details. So it's probably not a surprise for you, but is going to be a change in how we interact with the system. Next slide, please, Claire.
Bianca, we did have a question about the logins, and I was wondering it might be a good chance to answer it now.
I think that's coming up in just one slide. Yeah, right. And if I don't answer, please remind me.
Yep.
So steps to go live. The go live date is planned and still planned for the 1st December 2021. So very soon. What that means is there will be a transition period. So anyone who is enrolled in the COVID positive pathways before the 1st of December, no matter where they're at in that sort of disease period, will continue to be managed. I've said managed in COVID monitor. That should be Redcap. My apologies. That slide is incorrect. And so that means that GPs will continue to receive those Redcap surveys until the patient's discharged. But any patients enrolled in the pathway from the 1st of December will be loaded into COVID monitor. So there will be a period of transition. It's unavoidable, unfortunately. So access to COVID monitor, so hopefully addressing the question around login. So it's two-factor authentication system, as I said. Practices can identify the staff they wish to have access. We do recommend that each user has an individual login, and that will help with the log recording, but I'll explain that in a moment. But practices can use a central email to log in if this is preferred. We're going to send a go live pack to practices this week that will have that initial sort of generic password. So attached to the practice email, and a password, but then also an ability to register individual users. So whether you want to register all the GPs in your clinic, you might have a couple of GPs that look after COVID patients with practice nurse support, and you want your practice manager who uses it at the system is at your end is totally up to you. You will get, there will be an email that we need to register the account. You'll then get a password upon first logging in, and we'll ask you to change that password. And then a PIN is sent, and it can be sent to both either the email registered to log in or to a mobile. And I guess it's important to note that for generic accounts, there is some notifications that are sent via SMS. Currently, the system is set up that a patient is allocated to a practice, not allocated to an individual GP within the practice. That's something that we wish to set up the functionality. We've been speaking to the vendors and have put it on a list for improvements post go live. But at the moment, those notifications will be sent to the key mobile number or the key email that we have on file, but that will become clear in the notifications. So hopefully that answers the question around logins, but happy to come back to that if it didn't. We're going to be having sort of regular weekly drop-in sessions until the end of the year. For anyone who's got a question, we'll sort of have an hour set aside that people can drop in and ask anything that they like. We'll also be having ongoing support by the team, and there will be a help desk that's being set up by Royal Melbourne to support both the hospital and the GP users as well. But we'll also be providing support to any practices that are having patients for the first time enrolled through COVID Monitor. As I said at the start, really keen, welcome all feedback on functionality, any bugs that you're finding in the system so we can continue to advocate for changes and improvements post go live. The advantage or maybe disadvantage that we have in our region is that we've got a really well-established process of GPs looking after patients. So really quickly, we're going to get a huge amount of GP feedback on what's working and what's not in the system that we can continue to build and improve the functionality as we go on. Thanks, Claire. Next slide. So just a little bit about symptom monitoring, because it is the new feature. So once COVID positive patients are enrolled in the pathway, they'll start receiving a link to complete symptom monitoring daily. This includes when the period of time when they're waiting for an assessment. The assessment centre is now doing sort of today's assessments today, if that makes sense. So there's no backlog like we did have when we had that really big spike of sort of over 2,000 cases a day. Symptom monitoring will happen for all patients allocated to low risk. So those that are allocated to be looked after by their GP. Patients are sent, as I said, a daily text with a link to complete the symptom monitoring survey. They don't need to download any apps or anything. It is quite simple to use from a patient end. And all of this symptom monitoring feeds into the dashboard that's accessible by practices. Patients are also, we are, I guess, putting some of the, maybe not the onus is the wrong word, but control back in the patient's hands. So if a patient has completed a symptom monitoring survey that is indicating they have moderate or particularly severe symptoms, there will actually be an SMS directing them to seek assistance. So either to, in the case of moderate, to contact their GP, or in the case of high, to call 000. What we don't want is patients thinking that I filled in a survey and someone's going to look at that. We really want to make sure that that's escalated if it needs to be. So patients will be still allocated to low risk care for care by GPs, as we have done throughout the process. GPs were encouraging to check in with the patient initially for assessment, coordinate reviews, but there is that flexibility that I spoke about with the follow-up schedule, supported by the symptom monitoring. Currently, the written referrals that you're getting will continue outside of the COVID monitor system, and they'll be a really good way for you to realise that there's a patient that's been obviously notified of the referral, and as a prompt to go into COVID monitor and have a look at the patient history from there. Next slide, please, Claire. Okay, so now is the bit that you hope that the system works, and they say never work with children and animals, but maybe it's the same for never work with test systems. So I just want to flag this by saying this is a test version of COVID Monitor, so there will be a specific URL that's set up when this goes live. So I'm hoping that this all does work, but I'll just do a bit of a run through, and what I'll do is I'll give a bit of an orientation to the system and the reports that are available. We'll drill down into a little bit about what the patient detail information is, all fake patients in our test system. And then I'll talk through sort of how to monitor patients through that. So I'm just going to share my screen. And hopefully, can you see a COVID monitor login?
Yep,
there?
that looks good, Bianca.
Great. So what you do is you would add the email, the password, and then sign in. Once you press that, it will then send that authentication pin, like if you're logging into your banking or something. But here is one I prepared earlier in the case it wasn't going to work. So I've logged in as a practice. So I'm working at test practice. And the screen that it opens on is a list of my active patients. So as I said, all fake patients within here. The top, the three bars that you can see here, the three lines is the button for the menu. So if you click on that, I'll just kind of talk through that. The all patients list is probably not something that you'd be referring to a lot. It's more of a historical list, and I guess to say historical of anyone who's been in COVID monitor. So this will only start collecting patients from the 1st of December we go live. It won't have any of the patient details that have been through for in Redcap previously. But what this is all of those patients that have been COVID positive in the West Metro pathway at any one point. So if you wanted to go back to see actually was it this patient did have COVID, you can go in here, as I said, from the 1st of December and have a look at that. But it's not something that you use every day. The reports or lists that you're most likely to be using are in here under COVID positive patients. So active patients, this is a list of patients that are active on the pathway, and it will show up, and if I click on this, patients that are currently associated with your practice are currently on the pathway. So within that kind of 10 to 14 days that Nicole spoke about, but any care pathway. So if I just have a look here, you can see care pathway and pathway category. So I've got 2 patients at this particular practice that are actually in the medium risk. So I don't have any, I'm not looking after those patients, but it's just giving us that, yep, if, you know, I speak to this patient, Larry Lowe, I can see that Larry Lowe is actually being cared for by Royal Melbourne in the medium risk category. But these other low ones are probably allocated to me. The list that's most likely to be used by practices is the assigned active patients. And what that means is patients that are allocated to the GP practice, so test GP practice, that are low. So this patients assigned, active patients assigned are the ones that I am looking after as part of the practice. The patient follow-up list. So this is anyone who requires follow-up. So if you're looking at this from a practice level, this is probably something that you would check each day in the clinic. You're able to download a patient list. So if you want to download that and be able to share it with other people in the team, you can. And follow-ups are things that require an action. So it could be that a scheduled follow-up date has been set and hasn't been checked in, that the priority has changed. So someone might have put in symptoms overnight that have said actually they feel or sort of completed a symptom monitoring survey saying, excuse me, they're feeling a little bit worse, and their symptomatic may come up like this patient's did, Tom training as severe. Or it could be that they have a social concern. So like Redcap, there is both some social and clinical questions. And then the no observations is those people that actually haven't ever added in any observations. So there will be some of these patients. There'll be patients that appear on the follow-up list that potentially started doing their symptom monitoring and have stopped. And they could have stopped because they're sick of doing the symptom monitoring. They could have stopped because they're starting to feel better, or they could have stopped because they're actually unwell. So they will appear in the follow-up list, but Jackie is appearing because she's never completed symptom monitoring. And some patients are going to be like that. They might choose not to. They might not have a mobile phone. They might find it difficult to complete that. And so we'd be suggesting for patients on this list to continue managing as we have been doing. So a phone call to that patient every couple of days to check in. So that's a little bit about the kind of overview of the reports. If I jump in now to assigned active patients, and just to flag, we're developing a user guide for this, so don't imagine anyone's going to remember all of what I've been talking about, but there will be a step-by-step user guide that's available, as well as one big pack and smaller sort of fact sheets. So if I jump into Theo, for example, to see the patient details, it's just a double click on their name anywhere along that line. And it brings up the patient details. None of this is able to be edited by GP users. This is done sort of at the assessment centre section. But we often get GPs asking, or practices asking, I know that there's a number of positive patients in the household. Am I going to be getting those patients? And there's a click of the button you can do here on the address search that will actually come up. If there's other positive patients at that address, it will say that these patients are linked. So you'll be able to sort of manage it from a household perspective as well as individual. But in this case, no one else in Theo's household is a known COVID positive patient at this time. It goes through and it talks through, so I'm just going to shut my door. Cleaners in the office, their care pathway. So they're currently general practice low, and in the real system, this will say test practice or whatever practice your name is. It says that they're obviously the cohort, they're detected COVID positive, but the last symptom severity that Theo put in was normal. Their expected clearance date, this is a test system, was the first, but it will have the expected clearance date, which is often something that people are a little bit confused about or asking GPs about, and when they've last done their observations. There's a timeline that you can scroll into to get a little bit more information, and this will show when the patient tested positive, but also their symptom monitoring over time. It could be patient-reported symptom monitoring, or it could be clinician-reported symptom monitoring. So you've called the patient and gone through the symptoms with them. But it shows over time that on the second they were moderate, he's then severe, now mild, and now he's actually normal. Well, normal symptoms, I should say. And it also shows the history, symptom history over time. So everywhere where there's one of these boxes, you can search. And there's a whole heap of information. It's about 21 symptom questions, so a huge amount of information, but it shows over time if you want to be seeing whether that patient's, their shortness of breath, for example, is getting better. And in this case, you can see the most recent at the top. Yes, there's no shortness of breath at all at the moment. The swab history is here, so you can see when the patient tested positive, and then there's patient's note history. So this will automatically, each time a patient changes the care pathway, it will come up here. So you'll be able to see that actually a patient was low, potentially you've escalated them to medium, and then they've come back to you in low. So that will all be there. And then there's a log date. So that actually has the outcomes of the notes, and these are notes when you speak to the patient, and I'll talk through that in a moment. But it says when and who has actually logged that and what the notes were. So that's a little bit about the patient details that are available. And then to sort of talk through around the patient management. So I guess just to talk through this menu on the side here, what we're suggesting is that every time you make contact with a patient, you complete one of these dark blue options. So either that you contacted the patient, no escalations required, you'll continue to monitor, clinical escalation is required, or social welfare escalation is required. If social welfare escalation is required, that it goes onto a report that CoHealth actually look at, who provide the social support for practices. What's really important to emphasise here is if you were concerned, so that, Theo, you've spoken to Theo, you're concerned about the symptoms and you want to escalate, you indicate that you've escalated here. And if you do that, it will pop up, as with Redcap, what are the numbers that you need to call to escalate that patient. But escalation still has to happen outside of COVID monitor. So there's still a requirement for you to call patients. Send SMS. So you might be checking in with Theo and Theo's like, I deleted the message by mistake. And you're like, I'll resend you the symptom monitoring survey. And just by clicking on that button, it automatically sends an SMS to the patient to ask them to redo the symptom monitoring. Schedule follow-up. So you can see this scheduled follow-up date here. You can set this if you want to say, actually, this patient's been going okay, I'm going to contact them in another 3 days. You can actually schedule that follow-up and change that date, and it will change it down there. You can record notes. Like with Redcap, this is completely optional. If you want to keep a note, if you want to record a note, you're more than welcome to do that, but it's not a sort of a compulsory part of the system. You can also request clearance and discharge. So similarly with Redcap, There's a number of options. So if the patient decides that they don't want to be monitored anymore, which does happen, they can withdraw consent. You might not be able to contact the patient. So the same process still is that you would let the Western Public Health Unit know that you can't contact the patient, but this is another way that you're able to discharge the patient from the system. Patients may also decide that they don't want the text messages anymore. They can be turned off, but either at the assessment centre end or by, at the GP practice end. The patients can't turn that off themselves, though. They have to request that to be turned off. Thea might say he doesn't want to receive them anymore, and then he decides, actually, no, I'd like to, and it's a simple matter of turning back on the SMS reminders. So just quickly to run through record patient symptoms. I'm conscious we're running out of time, but there's a whole range of questions here. They are all drop downs. This is the same that the same questions that the patient will receive. But if you want to check in with the patient, you can run through this. There is now an asymptomatic button at the top. So if you're talking to someone, they're double vaccinated, they're actually feeling okay, you, rather than going through all of the questions, you can actually hit asymptomatic. It automatically fills that out for you. And then you can press record observations, and that automatically, as I said, downloads a PDF to your system that you can then, which is a pretty simple document. Hopefully it shows up here. Yeah, that just runs through. You can either upload that to your system or just cut and paste into your clinical software so that you don't need to do that again. I suppose what we're updating is, as I said, in terms of resources, there will be a user guide. We are going to update our one pager that makes it really clear in terms of what general practice should be doing as part of using COVID Monitor. One of the things to say, and I mentioned it from a patient perspective, is the messages that are sent to practices are really clear that we're asking patients to not complete symptoms overnight. We're saying to complete between 9 and 5 in terms of follow-up. If a patient indicates one of 4 really high-risk symptoms, so severe chest pain, coughing up blood, and there's 2 others that I can't quite remember. I'm not sure, Nicole, if you can remember them. An SMS is sent to both the patient and to the GP. So as I said, in the case of a generic account, that will be to the nominated mobile for the clinic. So ideally, GPs and others in the clinic are starting to use individual logins. But for the moment, that's how that will be set up. And we'd be suggesting that patients that are sort of flagging a moderate symptom, that sort of a check-in with the patient happens kind of that day or the next day. And if it's severe, then that's sort of checked in with the patient on the same day would be ideal. But as we said, there is a message that's going to go back to patients to encourage them also to reach out if they need support at that time. So I think I've covered kind of the big things that's currently happens around recording symptoms, documenting a consult that's happened, which is using these was blue, and now I've selected has actually grayed that out. The escalation process remains the same, as in a phone call to the receiving service, and discharging a patient in COVID Monitor by using this request, clearance and discharge, which is quite similar to Redcap now, but I guess you can see and have a history of the activities that you've undertaken as part of that patient care. So